Zofran, or Ondansetron, is used by veterinarians to help control nausea and vomiting in dogs. Ondansetron is an antiemetic that helps reduce nausea and vomiting by blocking serotonin signals. Vets may use Zofran for severe vomiting, nausea, and certain conditions requiring antiemetic support. Veterinary dosing is weight-based, so your dog's exact weight is important before treatment. Merck lists oral ondansetron at 0.1 to 0.2 milligrams per kilogram every 12 to 24 hours. Zofran may be given by mouth, with or without food, exactly as directed by your veterinarian. Rare side effects include constipation, sleepiness, or head shaking. Serious reactions need veterinary attention. Use extra caution with heart rhythm problems, liver disease, intestinal blockage, or certain drug interactions. If a dose is missed, give it when remembered, unless the next dose is near. Never give 2 doses together. Never calculate or change Zofran dosing alone. Always follow your veterinarian's specific instructions. For a dosage calculator, detailed benefits, potential side effects, which dogs should avoid this medicine, and safe serving ideas, visit our website through the link in the description.